Welcome back to another episode with ByrdAdatto. And today, Michael, do you remember the song by The Clash, Should I Stay or Should I Go?
Well, yes, of course.
Yeah, and today I started thinking about that song, and basically, if you remember some of the lyrics, it's should I stay or should I go? If I go, there will be trouble, but if I stay, it will be double. That's the basic gist. And it reminds me of what's going on right now for a lot of practitioners, especially in Texas. Because in Texas, the governor just signed an executive order that it appears that they can now do elective services, but it's not exactly correct. Is that right?
It's as clear as mud. Why, why don't you give the Reader's Digest of what it says, and then I'll share a little bit of what I'm hearing and how we're reading
Perfect. Well, so the for those who have been following, on Friday, the governor did sign a new executive order, and this executive order, it basically said, "Hey, I'm going to lessen the threshold that was there." So there was a very strong restriction in Texas about doing non-essential or emergency procedures. But then what the government did shifted, it said, "Okay, well, you can do it so long as it's in accordance with the standard of care of a clinical practitioner, and it won't deplete the hospital capacity or deplete the PPE that is needed to fight this, or if you do these surgery procedures at a licensed healthcare facility and the facility completes some certification process. The certification process has to be submitted, has to do with the capacity of the hospital. Again, it looks at, again, whether or not the PPE will be used from a public source. So all these are important factors when you read the order, but as you said, it's clear as mud in some ways.
it. I think the only way to really walk through this is first to start at the 50,000 foot level. And so, what we know from talking to our clients who are directly connected to Austin and to the society in Texas for the Texas Society of Plastic Surgery is that it appears that there was an intent to open up elective surgeries last week, preceding the order, that was the way things were going. Wasn't so clear about what would happen with non-surgical procedures like med spa treatments, but everyone was optimistic when the order came down Friday. And the order did make it clear under some circumstances that elective procedure would be appropriate. And in fact, many of our clients that operate at a hospital or at a certified surgery center have cases scheduled this week. Where it's less clear is with kind of the surgery suite connected to a practice, which is really common in cosmetic surgery. And the order, you can read, I can't tell you how many times I've read it. I know you've read it, and you can slice and dice it. And the fact is that the order doesn't deal with it. And so you can either read it as the fact that it doesn't deal with it, doesn't open it up, which creates risk, or you can read it to where the fact that it doesn't deal with it, it fits into that broad first exception. So as long as you're not depleting hospital capacity and PPE, you're good to go. And we have clients taking both positions. We have a lot of clients who are scheduling and kind of will back off and reschedule if the medical board tells them not to. And then we have some clients who are waiting for the medical board before they decide to schedule. The good news, hopefully, is that we believe the medical board will come down with some guidance today, if not tomorrow. And that hopefully will clarify it. I think people are generally optimistic that it will be opened up. And if it is, it'll end up being a major test case for around the country. And, just hoping that, we don't have some bad COVID outcomes through this, because the governor was really smart in the way he wrote this, and he could close it back down pretty easily. And of course, we know the other states will be watching what happens. So, we've been having a lot of conversations with clients about, what does this look like and what are the safe measures that can be taken when we start back up again.
Yeah, and I think the last thing is to add into all that is that right now, as we're shooting this video, The Texas Medical Board has not updated their emergency order. It does expire April 21st. And so that is one of the reasons why we're very cautious about jumping back into this, because right now, if you are doing elective procedures in the state of Texas, it is considered that you are putting public health at risk, and you can immediately have your license suspended. So that's why that order expires the 21st. So again, take that all into account. And as Michael just alluded to, we should know some information probably by the time this video is posted, how the medical board reviewed it. But that's all the time we have today. Michael, unless you have anything else to add?
No.
Perfect. Well, thank you so much for joining us, and we look forward to speaking with you next time.
Thank you.